For dogs with sensitive skin, the fight against fleas is a constant worry. Are you sure their treatment isn't making it worse? It doesn't take an infestation. For a dog with flea allergies, just one or two flea bites can trigger non-stop, intense itching. This isn't a simple itch. It's flea allergy dermatitis, or FADE, where the immune system overreacts to proteins in flea saliva. And it gets worse. FAD can intensify as a dog ages, leading to chronic infections and behavioral issues from the constant distress. So how do you protect them? We'll uncover risky ingredients, find safer alternatives, and build a complete management plan for relief. You use a flea treatment, but your dog seems even more uncomfortable. Could the medicine itself be causing the problem? Watch for the signs. A reaction can include skin inflammation and hives, but also watery eyes, breathing issues, and sudden lethargy. You have to know the difference. Some mild redness at the application site is normal for the first day or two as the medicine absorbs. A small pink spot is one thing. Hives all over, facial swelling, or frantic scratching is a serious red flag. Don't ignore it. If you suspect a true allergic reaction, stop the treatment immediately. Your next action is to call your veterinarian. Do not wait. But why does this happen? What exactly is in these treatments that causes such a severe reaction? The answer is on the box. Many topical treatments contain pyrethrins. They are effective against fleas, but are a known allergen for sensitive dogs. It's not just topicals. Newer oral pills contain isoxazolines, which are linked to neurological side effects like tremors or seizures. So the answer is clear. Ingredients like pyrethrins and isoxazolines are potent chemicals that demand caution for your specific dog. Knowing the risks is the first step. So, what are the safer paths forward? How do you choose a treatment that actually helps? For dogs with skin contact sensitivity, oral flea treatments can be a great alternative, bypassing topical reactions entirely. Look for products specifically marked for sensitive skin. These formulas intentionally avoid common irritants and harsh fragrances. Similarly, hypoallergenic products go a step further. They are designed with minimal ingredient lists to lower the risk of any reaction. We've covered safer chemical options. But what if you want to add more natural or supplemental approaches to your routine? Natural repellents, like diluted peppermint or rosemary oil, can help. But natural isn't risk-free. Always dilute and spot test first. For managing the itch itself, regular baths with a gentle, oatmeal-based shampoo can provide immense relief and soothe inflamed skin. We've focused entirely on treating the dog. But what if the real key to victory lies somewhere else? Are you missing the biggest piece? Most of the flea life cycle, eggs, larvae, happens in your home. Consistent vacuuming and washing dog bedding is non-negotiable. This shifts your strategy from reactive to proactive. By controlling the environment, you drastically reduce the chance of bites. Recall how just one bite can trigger FAD. That's why many vets recommend year-round flea control, even when you don't see fleas. So, to answer our question, no. Treating the dog alone isn't enough. An effective plan integrates safe treatment with home control. You now have the pieces, the problem, the risks, and the solutions. How do you assemble them into a plan for your dog? This is where your veterinarian becomes your most important partner. They can create a plan based on your dog's specific sensitivities. First, know the difference. Flea allergy dermatitis versus a treatment reaction. The symptoms may overlap, but the cause does not. Second, become an ingredient detective. Read labels and discuss risky chemicals like pyrethrins and isoxazolines with your vet. Third, look at other options, from sensitive skin formulas and oral medications to supportive care, like soothing oatmeal baths. And fourth, flea control is an environmental battle. Consistent cleaning is just as important as the medicine you choose. The constant scratching and misery isn't inevitable. With careful consideration and a proactive plan, you can provide true relief. Your dog relies on you to be their advocate. Take this knowledge, talk with your vet, and build the safest defense against fleas. Share this video with a fellow dog owner who needs it. For more pet health tips, subscribe and see our other videos.